Welcome to today's video about what causes blood cancer. Blood cancer, a silent killer. You may have heard of leukemia, lymphoma, or myeloma, but what's causing these devastating diseases? Did you know that some of the most common causes might be things we encounter every day? What if something in your DNA could raise your risk? Or a chemical you've been exposed to without even knowing? What if it's connected to your family history or your job? What are the hidden risks that nearly 1.3 million people face every year? Could it happen to anyone? In this video, we're diving into real research, proven data, and the surprising factors that could be contributing to blood cancer around the world. And don't worry, we're also talking about how you can protect yourself and your loved ones. So stay with us until the end, because the information you'll learn could make a huge difference. Let's uncover the truth together. Please note, this content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a healthcare provider regarding any medical conditions or concerns. Now, let's break down what might lead to blood cancer. Let's start with reason number 1: genetic mutations. Mutations in our genes can drive blood cancer by disrupting normal cell functions. In healthy bodies, our cells grow, divide, and die in a controlled way. When genes that control this process mutate, the result can be rapid, uncontrolled cell growth, leading to cancer. For example, mutations in the TP53 gene, often called the guardian of the genome, can prevent cells from repairing DNA damage, which allows cancerous cells to thrive. A 2024 study published in American Society of Clinical Oncology educational book highlighted how TP53 mutations contribute to multiple types of leukemia. Another key player is the FLT3 gene, especially in acute myeloid leukemia, or AML. A 2019 article from Leukemia Journal showed that FLT3 mutations are found in about 30% of AML patients and often lead to more aggressive forms of the disease. These genetic changes are not always inherited. Many occur during a person's lifetime due to environmental factors like radiation or chemical exposure. Mutations like these act like faulty instructions, causing the body to produce abnormal blood cells. Over time, these abnormal cells crowd out healthy ones, weakening the immune system and disrupting blood function. Next, number 2, family history. Having a family member with blood cancer can raise your risk, and it's not just about genetics. Some inherited gene mutations increase susceptibility to conditions like leukemia or lymphoma. For example, mutations in genes like BRCA2 or RUNX1 can make you more prone to developing blood cancers. Research published in Science, 2021, showed that mutations in DNMT3A and TET2, commonly associated with clonal hematopoiesis, elevate blood cancer risks as we age. What's interesting is that familial blood cancer doesn't always appear the same way. If a parent or sibling has had leukemia, your chances may be slightly higher, but not necessarily the same type of blood cancer. Genetic predisposition plays a big role, but lifestyle and environmental factors often trigger these genetic risks. Researchers are still working to pinpoint how these gene-environment interactions contribute. Staying informed about your family's medical history can help you and your doctor assess your personal risk more accurately. Next, number 3, exposure to radiation. Radiation exposure can play a significant role in causing blood cancer, particularly leukemia. When high-energy radiation enters the body, it can damage the DNA in cells. DNA is like a blueprint for how cells function, and when it's altered, cells may start to grow uncontrollably. This is one of the key ways cancer forms, especially in blood cells that rapidly divide. For example, survivors of atomic bomb explosions showed a sharp rise in leukemia cases, particularly acute myeloid leukemia. A study published in National Academies Press, 2012, highlighted that those exposed to radiation from these events had a threefold higher risk of developing blood cancer compared to those who weren't exposed. Even lower doses of radiation, such as those used in medical imaging like CT scans, can slightly increase the risk, especially in children. Research in Lancet, 2012, showed that childhood exposure to diagnostic radiation increased the likelihood of developing leukemia later in life. Radiation therapy for treating other cancers can also increase the risk of blood cancer. A study in JAMA Oncology, 2019, found that cancer survivors who received radiation treatment had a 4% higher chance of developing a secondary blood cancer like leukemia. Next, number 4, chemotherapy or radiation treatment. Cancer treatments like radiation and chemotherapy save lives, but they can also lead to blood cancer in rare cases. These therapies work by killing fast-growing cancer cells, but they can also damage healthy cells in the process, including cells in the bone marrow, where blood cells are made. This damage can lead to mutations in the DNA of these cells. Over time, these mutations may accumulate and cause the development of leukemia or other blood cancers. For example, studies show that people treated with alkylating agents, a type of chemotherapy, are at higher risk of secondary cancers, especially acute myeloid leukemia. According to a 2018 study published in National Cancer Institute, about 1 to 2% of cancer patients treated with chemotherapy develop secondary blood cancer within 5 to 10 years after treatment. Radiation therapy, particularly for cancers near the chest or pelvis, can also increase this risk by damaging the bone marrow. These risks are relatively low, but they're real. It's important to discuss all risks with your oncologist when planning treatment. Balancing effective cancer treatment with long-term health is key. Next, number 5, certain infections. Infections can play a surprising role in causing blood cancer. Viruses like Epstein-Barr virus, or EBV, and human T-cell leukemia virus, or HTLV1, are known culprits. EBV, for example, is linked to certain lymphomas, especially Burkitt lymphoma. Once the virus enters the body, it targets B lymphocytes, a type of white blood cell. Over time, these infected cells may start multiplying uncontrollably, which can lead to cancer. HTLV1 is another virus that directly infects T cells and can lead to adult T-cell leukemia. This virus causes changes in the cell's DNA, pushing them to divide more than they should. A study in Medicine Journal, 2019, showed that even chronic infections like hepatitis C can increase the risk of developing non-Hodgkin lymphoma. The virus causes ongoing inflammation, stressing the immune system, and eventually leading to mutations in blood cells. Infections don't directly cause blood cancer overnight. They weaken or stress the immune system, making it easier for cancerous mutations to form. It's a slow process, but one that's well documented in research. Next, number 6, smoking. Cigarette smoke contains over 70 known carcinogens, chemicals that can damage cells in the body, leading to cancer. When you inhale these toxins, they enter your bloodstream and can cause harm not only to your lungs, but also to your bone marrow, where blood cells are produced. This toxic exposure disrupts the normal function of stem cells in the bone marrow, increasing the likelihood of mutations. Over time, these mutations can lead to the uncontrolled growth of abnormal blood cells, which is the hallmark of blood cancers like leukemia. A 2014 study published in American Journal of Hematology highlighted the direct link between smoking and acute myeloid leukemia. The research showed that smokers had a 30% higher risk of developing AML compared to non-smokers. The study also pointed out that the longer someone smokes, the greater the risk becomes. These findings underscore how the duration and intensity of smoking can directly influence your chances of developing blood cancer. The body's ability to repair DNA is also compromised by the chemicals in cigarettes. As a result, repeated damage from smoking creates a greater opportunity for mutations, leading to the development of blood cancer. Next, number 7, immune system disorders. When the immune system is compromised, the body can struggle to regulate abnormal cell growth. This opens the door to blood cancers like lymphoma and leukemia. For instance, in people with HIV, the weakened immune response makes it harder to control the growth of malignant cells. Research shows that those with HIV have up to a 25-fold increased risk of non-Hodgkin lymphoma compared to the general population. It's a significant connection that highlights how immune dysfunction directly impacts cancer development. Chronic inflammation from autoimmune diseases also plays a role. Conditions like rheumatoid arthritis or lupus keep the immune system constantly active, causing damage over time. This ongoing state of inflammation increases the chances of abnormal white blood cells forming and turning cancerous. A study published in Journal of Clinical Immunology, 2020, shows that people with immune disorders like common variable immunodeficiency have a 10-fold higher risk of developing lymphoma. This is due to the constant stress placed on immune cells, which can lead to errors in DNA replication, resulting in cancer. These findings emphasize how crucial a balanced immune system is in preventing blood cancers. Next, number 8, benzene exposure. When you're exposed to benzene, a chemical found in things like gasoline, cigarette smoke, and certain industrial products, it can be harmful to your blood and bone marrow. Your bone marrow is where new blood cells are made. Benzene interferes with the way these cells develop. This can cause your body to produce abnormal cells, leading to conditions like leukemia, especially acute myeloid leukemia. Even low levels of benzene over a long time can damage the DNA inside your blood cells. Studies have shown that benzene breaks down inside the body and forms toxic compounds. These compounds stop cells from maturing properly and cause mutations. Over time, this can cause cancerous cells to grow. The journal Environmental Health, 2010, reported that people exposed to benzene at work had a significantly higher chance of developing blood cancer compared to those not exposed. The effects of benzene aren't always immediate. Sometimes it takes years for these problems to show up, making it a silent danger. Protecting yourself from benzene is key, especially if you work in an industry where exposure is common. The sooner you reduce your contact with it, the better. Next, number 9, age. As we get older, our risk for blood cancer tends to rise. This happens because the cells in our body start to experience wear and tear over time. Our bone marrow, which is responsible for producing blood cells, can undergo changes due to this aging process. Over time, genetic mutations can accumulate in the blood-forming stem cells, making it more likely for them to grow abnormally and turn into cancer cells. Aging also weakens the immune system, reducing its ability to spot and destroy abnormal cells before they become cancerous. This drop in immune function gives cancer cells a better chance to survive and multiply. For example, a study published in PNAS 2023 shows that individuals over 60 have a significantly higher risk of developing acute myeloid leukemia due to age-related changes in the bone marrow microenvironment. The study found that 75% of new AML cases occur in people aged 60 and older. This doesn't mean every older adult will develop blood cancer, but it explains why age is such an important risk factor. Regular screenings and a healthy lifestyle can help catch early signs, especially if you're in the higher risk age group. Next, number 10, environmental toxins. Environmental toxins are all around us, from the air we breathe to the products we use. Many of these chemicals, especially pesticides and herbicides, can interfere with our body's natural processes. Research shows that prolonged exposure to these substances may cause mutations in cells, which can lead to blood cancer. One study published in Environmental Pollution in 2017 found a clear association between high pesticide exposure and an increased risk of non-Hodgkin lymphoma. Farmers, landscapers, and people who work with chemicals often face these risks due to consistent, high-level exposure. The toxins damage DNA in blood cells, and over time, this damage can result in cancerous changes. Even everyday products, like some household cleaners and lawn treatments, may contain harmful chemicals. Although the risk from these sources is lower than for people working in agriculture, the cumulative effect over years may still play a role in developing blood cancers like leukemia or lymphoma. Staying informed about the chemicals in your environment and minimizing exposure can help reduce the risk. Simple changes like using natural alternatives and proper safety gear when handling chemicals can make a difference. Next, number 11, occupational exposure. Occupational exposure can play a major role in causing blood cancer, especially for people working in certain industries. Some jobs expose workers to chemicals and substances that affect the bone marrow and blood cells. For example, people working in industries such as rubber manufacturing, paint production, and the petroleum industry may be exposed to harmful solvents and dyes. These chemicals can damage DNA in blood cells over time, increasing the risk of leukemia and lymphoma. A study published in Leukemia Research highlighted the connection between prolonged exposure to organic solvents and the risk of developing blood cancers. Workers exposed to these chemicals for long periods were found to be 1.4 times more likely to develop leukemia compared to those without similar exposure. The study pointed out that the toxins in these substances can cause mutations in blood-forming stem cells. Additionally, exposure to certain metals like lead and cadmium, often found in manufacturing or construction jobs, has also been linked to higher rates of blood cancer. Taking steps to limit exposure, like using protective equipment and following safety guidelines, can reduce the risk. If you work in a high-risk environment, staying informed about potential hazards is critical. Next, number 12, obesity. Carrying excess weight affects more than just your heart and joints. It can also play a role in the development of blood cancer. When fat cells increase in the body, they can trigger chronic inflammation, which puts extra stress on your immune system. This prolonged inflammation can lead to changes in your bone marrow, where blood cells are produced, increasing the risk of abnormal cell growth. One recent study published in the Current Obesity Reports in 2023 found that people with a higher body mass index had an increased risk of developing leukemia. The study suggests that fat tissue can secrete chemicals called adipokines, which may promote cancerous changes in blood cells. This makes it harder for your body to fight off abnormal cells before they become cancerous. Additionally, obesity can cause insulin resistance, leading to higher levels of insulin-like growth factors. These factors promote the survival and multiplication of blood cells, which may lead to uncontrolled growth, eventually contributing to blood cancer. If you're carrying extra weight, it's important to know how it could affect your health in unexpected ways, including blood cancer risks. Simple steps like losing a few kilograms can make a big difference in reducing this risk. Next, number 13, autoimmune diseases. Autoimmune diseases happen when your immune system mistakenly attacks healthy cells. In this process, the body's constant inflammation can create a higher risk for blood cancers, like lymphoma and leukemia. The chronic activation of the immune system leads to damage in the cells responsible for producing blood, like in the bone marrow. Over time, this constant stress on the body's immune cells can trigger mutations, which may lead to the uncontrolled growth of cancerous blood cells. For example, rheumatoid arthritis, which causes inflammation in joints, has been linked to an increased risk of non-Hodgkin lymphoma. Research published in Blood Cancer Journal in 2018 pointed out that individuals with long-standing autoimmune diseases are up to 2 to 3 times more likely to develop certain types of blood cancer. The study explained that the continuous immune response causes DNA damage in blood-forming cells, which can eventually evolve into cancerous growth. Autoimmune treatments, like immunosuppressants, also increase blood cancer risk. These drugs weaken the immune system, leaving the body vulnerable to the development of cancer cells. It's essential to monitor patients with autoimmune diseases for early signs of blood cancer, as early detection can improve outcomes. Next, number 14, hereditary syndromes. When certain genetic conditions run in families, they can sometimes increase the risk of blood cancer. This happens because the body's ability to manage cell growth and DNA repair might be weakened, leading to an environment where cancer cells can grow more easily. For example, Down syndrome is a condition caused by an extra copy of chromosome 21. People with this condition have a significantly higher chance of developing leukemia, especially acute lymphoblastic leukemia and acute myeloid leukemia. The risk is up to 20 times higher than in the general population. The extra chromosome disrupts normal blood cell development, which creates the perfect setting for cancer to develop. A research published in Journal of Clinical Oncology in 2011 discovered that individuals with Li-Fraumeni syndrome, a rare inherited disorder, have a higher risk of not just blood cancer, but other cancers due to mutations in the TP53 gene. The TP53 gene normally helps control cell division and repair DNA. When it's not working right, cells can grow out of control, leading to cancer. If someone in your family has a genetic condition like these, it's important to discuss your personal cancer risk with your doctor. Early detection could be key. So, now that we've uncovered the hidden risks, it's clear awareness is power. Whether it's understanding genetic factors, staying mindful of environmental exposures, or simply knowing your family history, you're already taking the first step toward protecting yourself and those you care about. If this video helped you, don't forget to hit that like button and subscribe for more content that could keep you informed and healthy. And share this video with someone who needs to know these important facts. Together, we can spread awareness and make a difference. Thanks for watching. Stay informed, stay empowered, and see you in the next one.